When I'm dealing with some of my clients, I hear my clients say that they have alopecia. But did you know that alopecia is just a form of hair loss, and there are many different types of alopecia? So in this video, I'm going to go over some of the most common types of alopecia that you can experience. I'm Dr. Nina, and on my channel, we talk about using functional medicine, hair health, and a holistic lifestyle to be your best self. Okay, so when we talk about alopecia, we want to break it down into two segments. We want to talk about scarring alopecia and non-scarring alopecia. So non-scarring alopecia is pretty popular, and that's where we talk about male pattern hair loss, genetic hair loss, female pattern hair loss. And this is more geared towards how the hormones is affecting your hair follicle. And when we're looking at these types of hair loss, we see where the hair strands actually starts to shrink, which is called miniaturization. Then there's another form of alopecia, which is called Telogen Effluvium. So telogen effluvium is when your hair is going through a shedding storm, and it could be medication, stress. A lot of times can cause this to happen, and typically it should last anywhere between 3 to 6 months. If you're noticing that you're still shedding after 3 to 6 months, then definitely it's time to seek help from a professional. Then we have Alopecia Areata, which is very distinctive. This is where you start to experience hair loss, and we see circular patches in the scalp. Now this is important because this is a sign that there is something that's happening inside the body, such as maybe the immune system is attacking the follicle. There could be an issue with your thyroid. I've seen in cases where there was also parasites with alopecia areata. Now let's talk about some of the common scarring forms of hair loss. Number one that we see in the Black community is called CCCA. CCCA is a form of a scarring alopecia that can start in the center and it spreads out. It is an inflammatory type of alopecia, and if untreated, then hair loss can take place as well as scarring. Also in the scarring family, there is a hair loss that's called Lichen Planopilaris, which is LPP. This particular type of hair loss is formed because the T cells, so this is your immune system T cells, is attacking the hair follicles and causing some form of inflammation, and then you start to lose hair. Also, there is one where I see a lot of my older clients get, it's called Frontal Fibrosing, and this is when you tend to lose hair around the perimeter. This one is very tricky because if you're African American, a lot of doctors will say, oh, it's traction alopecia. But in cases like this, it's not. So this is where you definitely want to have some blood work done, because right now there is no, how can I say this? There is no scientific proof to kind of show how women are coming out with this particular type of hair loss. But what I have identified is that I've known that low estrogen levels can definitely be a contributing factor, as well as having some form of autoimmune conditions. We've seen diabetics have this type of hair loss as well. So you have the scarring type of alopecia and the non-scarring alopecia. If you can identify with some of these type of alopecias that I mentioned, then please book an evaluation with me. I'll be happy to help you to do a full assessment so that we can get to the root cause of what's contributing to your hair loss and get you on a great treatment plan for improvement. So if you like this information, please like and subscribe to my page. And until next time, guys, take care.